Dear Chairman, dear colleagues, thank you very much for inviting me here in this joint section. I would like to present you on office-based management of a patient with Alzheimer's disease. So our patient is a 62-year-old male with presenting for his first urological evaluation for mild lower urinary tract since 1 year. He is obese, and from his medical history, he is hypertensive, under medication, and he is a smoker. It's a very typical case. And his basic urological evaluation, in his physical examination, there's nothing much, just one right inguinal hernia. His IPSS score is 8, with only one episode of nocturia. His digital rectal examination is also normal, as well as the urine examination and blood tests. And the PSA level is quite low, it's 1.3. So next, ultrasound is made with normal upper urinary tract, normal bladder, prostate volume of 45 cc, and a post-void residual at 90 milliliters. Next, the free flowometry showed the Qmax of 13 milliliters per second. So this is quite a straightforward case for the moment. The patient started his treatment with a alpha blocker, tamsulosin in this case. Next, the patient missed his follow-up and presents again 5 years later. Now he's 67 years old and complains about urgency, and his wife complains about some kind of weird memory loss of her husband. So neurological evaluation is essential at this point. Actually, he has a short-term memory loss that lasts about 1 year. He has some weight loss also, this year also, and he's experiencing some language problems. His physical examination, his neurological physical examination is normal, and this is the mini mental state examination, which is a basic tool for the neurologist to assess a patient regarding his cognitive function, is 21, which represents cognitive impairment. So the possible diagnosis, or I would say the diagnosis, is dementia. But what kind of dementia, and why do we need to, as a urologist, to know what is the kind of dementia? We know that Alzheimer's disease represents the 60% of cases of the patient with dementia, with the cerebrovascular cause at 20%. But there are also some other causes, like Lewy body disease, very rare, and normal pressure hydrocephalus. And we need to know what type of dementia the patient has, because probably there is a different treatment, and the prevalence of lower urinary tracts are different in these kinds